My next guest is a doctor. He says Obamacare is collapsing under its own weight. Joining me now, he's Fox News Medical Aid Team, Dr. Marc Siegel. Explain what do you mean by that?
I'm excited to see what the doctor's office of the future will look like with all of these regulations rolled back. You got to imagine what it's like now. A patient comes in, the first thing I say is, well, do I have to cover this? Do I have to cover that? Is the doctor I want to refer to participating? Because many doctors are dropping Obamacare entirely. That also true for Medicaid. Less than 30% of doctors are actually seeing new Medicaid patients. Medicare, much less new Medicare patients are being seen by physicians these days. Because we look at the 10 essential benefits, Liz, that Obamacare mandates. And it's literally like a prefix meal where you go to a restaurant and there's a 7-course meal that you're paying into. So it's
meaning stuff you don't need, right?
Yeah, and it's an exorbitant cost. If you ever go to a prefix where it's 7 courses, it's a high cost, and half of the entries you don't want to eat. And you're actually buying them because someone else wants them. And I don't mean to disparage that, by the way, because I'm a big believer in mammograms. I'm a big believer in colonoscopies. I'm a big believer in screening blood tests. But our young people have caught on to that. A 20-year-old who's healthy does not want to pay for a 50-year-old's colonoscopy, and I don't blame them. So we get rid of all these regulations, premiums are going to go down. And you add an option that's more catastrophic, where you say to someone, here's the minimum. No one ever said that under Obamacare. Here's the minimum, and we're going to pay for it with tax-deductible dollars.
Meaning health savings accounts.
Exactly,
right?
and that's what Cassidy was saying today. Senator Cassidy was saying today. We're going to start with health savings accounts. Everyone's going to get a big tax deduction. You can use that to buy the services you need. And guess what? Healthcare of the future. I'll tell you a big secret. It's genetic-based. It's individual, it's personalized medicine. What works for you doesn't work for me. You're going to sit there with your physician and you're going to say, what about this option? What about that option? It'll be like a buffet.
Okay, stay with me on that, because there are, I hear what you're saying, there are some parts of Obamacare, though, that people do like. You know, they like the tax subsidies to buy insurance. I mean, yes, it hits a taxpayer. We don't like that. But the question is, if Obamacare gets yanked now, what is the Republicans' replacement for people, who need coverage? Because, maybe because the premiums, as you point out, have skyrocketed so high under President Obama that they maybe can't afford coverage right now and they're scared.
Okay, first of all of these plans, anything you buy is going to be tax deductible. With your health savings account, it's going to be tax deductible. Secondly, all of these plans are going to allow you to keep what you have. That's one untruth we're not going to reproduce here, where President Obama said you get to keep your doctor, you get to keep your plan. Well, doctors were fleeing, so you couldn't keep your doctor, you couldn't keep your plan. You're going to be able to keep your plan if you like it. Okay. That's number one. Number two, the Medicaid expansion for sure is going to stay in. So the idea that there's suddenly going to be 20 or 30 million people without insurance is not going to happen. If anything, we're going to be able to insure more people because we're going to offer them catastrophic insurance, tax deductible, purchased by a health savings account. And one more thing. At the state level. One of the key problems with Obamacare is it's all superimposed federal regulations. Going to be replaced with the states getting back involved again. And as Tom Price says, the doctor and the patient are going to make the decision.
Got it. And maybe buy insurance across state lines. Dr. Siegel,
hugely important.
Will you come back and give us an update?
Across state lines will drive down the price. Absolutely.